Well, we are live. It's 10:30 a.m. Thanks everybody who has registered to attend our webinar. We're going to stay put and wait a few minutes to give everybody some time to make it in, and we will launch in just a couple of seconds. I want to thank again all our panelists who have made time of their day to join us. This is a really busy time of the year normally for back to school, even busier now given the circumstances. So let's get started. We have a little clip that we have prepared that will run through a bit of what was going on before we got to where we're today. Well, welcome everybody to Thrive Together, an open discussion with experts about COVID-19 and classroom design. I'm Polly Moore, Director of Marketing for MooreCo Inc. and Family of Brands, and I will be your host today. So let's go back to when we left for spring break. We were all looking forward to having some quiet, quality time with our family, but instead we realized that our kids would never return to school. We didn't return to our workspace, and the world literally stopped. So we're here today to try and help find some answers. What do we do? How do we do it? How do we do it well, safely, and on time for our kiddos to get back to school this fall? For attendees, we're gonna have the floor open at the end of the presentation. So as our panelists give their input and feedback, hang on to your thoughts, hang on to your questions. We will address them and they will answer them at the very end. And speaking of panelists, we have a great team of experts. And when we say experts, we really mean it. So I'd love to introduce them. Joining us today, we have Sylvia Kowak. Sylvia's Principal and Director of Interior Design at Legat Architects. Thank you, Sylvia, for joining. Robin Randall, Principal, Director of Pre-K through 12 Education, also at Legat Architects. Thanks, Robin, for being here. Dr. Tom Leonard, Superintendent, Eanes ISD, Austin, Texas. Dr. Leonard, it's an honor to have you on board. Steve Hulsey, AIA, President, Executive Manager and Principal, Education Sector Leader at Corgan Group. Dr. Lindsey Leininger, PhD, Public Health Researcher, Tuck School of Business, Dartmouth University. And Greg Moore, CEO, MooreCo Inc. and our family of brands. So thank you so much, guys, for joining us today. Let's get started with Dr. Leininger. On May 15th, the CDC put out guidelines on how schools could open in fall. Some of these guidelines included reduction of class sizing, social distance, above all, heightened hygiene to try and reduce the spread of COVID. Dr. Leininger, do you think these guidelines will help prevent the future outbreaks of the disease? Do you think these guidelines are enough? And who do you think is at most risk if these measures are not taken?
Well, thank you, Polly, for having me here today. It's really a pleasure to be on a panel with experts in education, much less experts from my near and dear home state of Texas. So although I'm up here in rural northern New Hampshire, my heart is still at home in Texas. So anyways, thank you so much for the opportunity to be here. And Just as a piece of background for my answers for the crowd, I am a public health educator and researcher, along with 9 other PhD trained public health scientists, nerdy girls. I have started a COVID science communication platform on Facebook called Dear Pandemic, fashioned after Dear Abby, the old advice column. And many of our followers are families with school children. They are teachers, educators, and other community leaders who are paying very close attention to these CDC recommendations right now. And so when we have the pleasure of posting about these types of measures, and when we talk to schools and help advise them on their reopening or businesses on their reopening, we focus on 3 things. And the first is the community context. So the rate of and extent of spread in your community is going to drive so much of your actions over the next year. So keeping your finger on the pulse of community context is key. The second piece is infection control. And that's really where these CDC recommendations come into place. And I think a lot of the cool, innovative design principles you're going to hear from the other people on this panel are really innovative ways to up our infection control game in schools. And then last but not least, and this is the piece of it that I think is getting lost in the fray, is the communication piece. So schools really are a trusted node of information, as we say in science communication, and your communities are going to be navigating a lot of uncertainty and expecting you guys to help them be engaged, educated, and empowered to exist under this pre-vaccine new normal. And that is a direct quote from the American Federation of Teachers. So you have these 3 roles to play. And I think that the CDC regs and other regs that you might read focus very heavily on the middle, the second C, infection control. And I do think that upping our infection control in general is going to help us combat the virus, but we need to honor that we're all going to be navigating a lot of uncertainty. And the best way to help people through is to have open, transparent, friendly, and positive communication with your school community. Because remember, if you have a case at your school, the contact tracing is going to need to happen. And there's a lot of distrust among traditional institutions right now that schools can help navigate. So again, 3 C's here. We've got community context, infection control, and open, honest, transparent, hopeful communication.
Thank you so much. That was very, very insightful. Steve, I would like to go into the topic. You have spoken a lot about the idea of cohorts in classrooms, and I do need my slide changed. There we go. In order to open schools safely. Now this has been changing by the day. Austin ISD, just as an example, said that they would start their schools in fall at 25% capacity. That means that a classroom will hold 6 to 8 students as opposed to 25 to 30 students, which is normal and average. What can be done? What do you suggest? How can this be effective?
Well, the things, thank you for the opportunity to present and talk about this subject today. And you're right, here specifically in Texas, we have had our school district clients in Texas have been waiting for until just recently for direction from the states, and that has been given, but it's still, there's lots and lots of options, as you would know, of what to do. And the cohort model that I spoke about before is part of what we term in our firm as our best practices report, which is a combination of reports from each one of our sectors, healthcare, as well as commercial, aviation, data centers, and education, that combines all of that knowledge into this report. So in the cohorts or in the groupings of classes, what we're looking at and what we're trying to control is the teacher and student access in a safe environment. So getting those educators and those students together in a safe environment of whatever size, as well as a cohort group. And the cohort group is basically a group that could be established from home to home. And what I'm meaning in the establishment of home to home is when the students leave their home to go to school, how does that whole process work? And it starts with the affirmation some districts are going to have about the students as they're going to school. They affirm that, yes, we don't have a temperature, they're symptom free. In a cohort group, what a district could do, and this is going to take a lot of logistics from school districts, which they're going to have a lot on their plate, but keeping a group together in a classroom setting with an educator, that even starts with transportation. So it may be their bus to class, so that the school district could change the whole grade level or whole student class setting, where the transportation goes and picks up students in a group that live close to each other, keeps them in their cohort on a bus, takes them to an entry of a school, and that's where this cohort goes in, as well as parents who drive their students or walk to school all come in the same door. Then they all go into the same classroom in that cohort group. And what this really does is controlling any potential infection that may come up, so that if you keep them in a cohort group from door to door, going in, and then going back home, then if an infection were to come up, you're able to control it in a wing in a school, or in a section of a school, or in a classroom setting, so that they can trace back to that group and hopefully be able to control the cohort enough where they're able to not have to shut down the entire school if an infection were to come. When you come to the classroom sizes themselves, and potentially having, instead of the 22 to 25 at an elementary school level teacher to student ratio, going down to a 25%, which is 6 to 8, or even a 50%, the creative use of the facility, if they're all going to be taught in person, is also another way to do this, where a classroom may become not only the classroom that they're used to, but it may be a media space that is converted into a classroom. We're assuming that in many cases here in Texas that food's going to be brought to the classrooms or the cohort. So the cafeteria space may also be converted into multiple classrooms and divided off. There's going to be a lot of creative planning depending on which level. And here in Texas, it's come up to, lots of the districts have come to a level of they're either going to be taught in person or they're going to be taught virtually, and how those numbers that are coming out, the surveys that the parents are turning in now and in the next month, are going to help the districts understand what those numbers are that are going to be taught in person, so that then they can go through the process of pulling these cohorts together and rearranging their schools to deal with the situation.
Great. I really appreciate that feedback, Steve. And as we carry on talking about the CDC and the recommendations, Robin, this question is directed to you. The CDC did recommend physical barriers to act as sneeze guards for a classroom where it was impossible for students to keep 6 feet apart. They're also suggesting face covering or masks. What are the solutions that you're seeing in terms of design and distancing in the classrooms? I know you spent the majority of your career specializing in pre through K to K through 12 education environments. So I'm sure you've got a lot of contributions to share with us. And do you think these would be safe enough?
Yes. So what we know, and Leggett is sort of this heartland community from Iowa to Ohio. Our offices and really birthed in Illinois. So we just came from a discussion about how everyone's waiting for governor direction, and what the superintendents are hearing right now is that it's going to end up being a local decision. And much in the way of the previous speaker talking about the cohorts is really how this is going to be tracked and followed. So as we move into the classroom, specifically, I'm going to take a cue from all the C's here. Why would you come to a classroom in the first place? E-learning at home is a version of learning. But why do you come to a classroom is really to connect with the teacher, right? So there's a reason for that human connection, and how do we do that safely in a classroom? So the connection of teacher to student has been talked about with a plexiglass screen at the desk. But what these, our frontline workers are using are the shields. And what that does is it breaks down the barrier a little bit more, and you can still get close to the student. You can come by and connect with the student and talk to the student without the danger of having that direct contact. Now, what we also know is that the 6-foot distancing is recommended for a reason, because that dramatically reduces exposure. And even with a 3-foot radius separation, we see that cases of exposure are going up. So that 6-foot radius, and we're joking about sticking noodles on top of our heads so that students know what that 6-foot radius is, and they can try and keep that. But if the teachers have the shield, they can get a little bit closer as long as the student is also wearing a mask. So what we're seeing is flexible furniture, movable furniture, encouraging that teacher-student connection, personal connection. We are actually seeing recommendations of more like 50% of use of the classroom. I know 25% for circulation and other things are being looked at. So variety of populations. But the other 2 C's I wanted to hit on, we talked about connection, is collaboration. The other reason that you come to school is so that you can directly collaborate with your peers. So how do we collaborate with a 6-foot radius? And it's tricky, right? It might be at a long table, it might be at different movable desks, but we need to turn and be able to communicate, make eye contact so that you have that connection happening. And then just spark curiosity. So what curiosity is contagious, right? So if one student is thinking about one thing, they can share those thoughts directly while they're in the space and connecting. I would say 95% of the school districts that we're working with are going to be going to a hybrid back to school in the fall. So there will be e-learning components, and then there'll be direct learning components. So looking at classroom and how to make that separation, there's a variety of solutions, but we're learning from our healthcare practice and what's happening on the front lines, and those shields are being the new thing beyond the mask being used by students as well as teachers. Thank you.
Oh, that's great. Thank you so much. Really appreciate that. We're moving on. Dr. Leonard, thank you for, and here was the little noodles you were talking about. I thought that was so good. I love it. And I think it brings the interactive part of kids being part of the solution, right? That they feel like they're contributing and fixing and fighting a problem. So I love that. I do hope a lot of districts pick up this as an option.
Well, it allows the students to be creative too.
Yes, exactly. Yes. And Dr. Leonard, thank you so much for joining us. I loved your address to our district last week. That was phenomenal. According to a poll by the USA Today and many others, 1 in 5 teachers don't feel comfortable returning to school as scheduled this fall. What measures are being put in place to try and ease the educators' anxiety, and what can be done for faculty that may be at high risk?
Yeah. Well, I think so much of what the previous speakers have said is interesting, and it's the same thing we've been thinking about for quite a while. I'll get to teacher safety in a second, but let me just weave myself there, if you don't mind. I've been working with superintendents in Texas and across the country, mainly California, Illinois, New York as well. And we've got some nice working groups that are sharing ideas and concepts. And what your speakers are saying is true. I don't care what state you're in. You get to a point where you have the governor, you have a county, you have a city, you have a state agency, you have the CDC. Even at the federal level, they're not all speaking with the same language in terms of directing superintendents and school districts, and some have gone into paralysis, not knowing what to do. The wisest ones, I think, have said, we're not going to wait for them. We've got to get ready for August, and we're going to move. And we're going to come up with a flexible, agile plan so that we can move back and forth no matter what is happening with the advice we're getting from different agencies or not advice, it might be restrictions that they give us. You know, the piece on percentage versus social distancing, it's interesting. You can tell someone they can be at 50%, but I can't double the number of schools. And if I'm gonna operate under 6 feet or double the number of staff, and if I'm not operate under 6 feet, I'm probably gonna be more like 20% no matter what percentage they allow us to go up to. I think we agree that the cohorts make sense, although one of the things we're struggling with is while we have our athletes right now, and in Texas, football is big and we're doing training camps. And while we have our athletes in cohorts, while they're with us, the reality is as soon as they leave us, their cohorts are disappearing and they're getting in the same cars, or they're meeting at a park, or they're breaking the goodness of the cohort, I guess. And then once I get one staff member, one custodian at a high school test positive, immediately I have 16 out because they are now quarantining due to contract tracing for the next 2 weeks. And then when they come back, if one other gets it, all 16 out are again out. And that's become extremely problematic. Safety is important. It's interesting, in some districts in California that I'm working with, they're finding that this has become a political issue. In some wealthy districts and in some rural districts, 80 to 90% of the parents want to come back, where only 20% of the staff wants to come back. And that math doesn't work. We need to keep our teachers safe. It's interesting, in Travis County in Austin, Texas, customers right now going into a grocery store and the workers in the grocery store are required to wear masks. But in our schools that are open right now, they're not. And why would we think it would be good for the safety of someone working in a grocery store to be safe with a mask when we don't think the same is going to be important for the teacher? So we're talking about many of the things that you've talked about thus far, but if I can't keep my staff safe, then they will get the virus. Contact tracing will take out probably a multiple beyond that, and we'll be remote in no short period of time.
Appreciate that, Dr. Leonard. Greg, the next question is for you. Hey, babe. MooreCo has been a leader in classroom design for over 35 years, and boy, have we seen many crises. How do you see MooreCo playing a role in helping schools reopen safely during this time of COVID-19?
Well, Polly, yeah, we've seen some different things before. Never one quite like this, and I would tell you that some of the things that we do have never been more important than they have become today. We've always, coming from visual communications and furniture, we felt when technology started to change a classroom, it was too important to ignore. So we're an environmental company, so we look at all of it, how it works together. And furniture certainly needs to work with technology, but as we're seeing, technology needs to be easily deployed, and it's not just about what happens in that classroom. So what we can do for people today is we have technology product, but it's not a check the box. It's flexible. Remember, we're furniture people, so we like things that are easy to turn on and off, easy to deploy, and that have flexible approaches that can allow you to do more with them today, whether it's one teacher teaching multiple classrooms. There's things like that that can help. And then if you look at the rest of our product offering, when you go into diversity of solutions, no time like today has made every challenge in every school district different. And one size hat will not fit all heads. So when you look at what we do and what we're trying to do, is to provide more solutions than just for one segment, and it's to do as much as we can for everyone. And quite frankly, this crisis has brought some change, and fortunately we're innovators. We feel like we're always trying to say, solve tomorrow's problems. COVID came along, and we did not. Go ahead, Polly.
Well, I was going to say, so while you're talking about that, so how does manufacturer responsiveness make a difference in a crisis like the one we face now? Can you share a little bit of what MooreCo did when the crisis started and where we are today?
Sure. Well, first and foremost, you're taking care of your people, and you're eliminating the risk out of the business, supply chain, what have you. But when you get into a situation like this, obviously this is not like the last recession. This is way different. And some people may call it worse than the Great Depression, but you've got a couple of choices. You can either go hide, or you can get to work and attack the problem. So we're innovators. We're always trying to solve tomorrow's problems. The first thing we saw was, okay, we've got a problem in healthcare immediately. What can we do to help? And as part of YPO, that's a big network across the country, Polly, and to see the demand and the need was worrisome, and to be able to help, not only, does it help your business and your people, but it helps your purpose, right? You're here more than just to be a business. And so we immediately got after it. How can we help frontline workers? What can we innovate that doesn't exist today in our product line? And how can we help the country keep on going? And so we got to work developing products without even understanding what the demand would be, but knowing that the safety needs were there. And, we've got two of our core values, business for the future and make it personal, has made this very important to us. And so you'll see some of our offerings that we have today, and what I'm trying to do is just eliminate stress for schools. They've got enough on their hands. I'm trying to provide solutions for everything.
Well, thank you so much for that. Steve, the American Society of Heating, Refrigerating, and Air Conditioning Engineers have said that HVAC systems can reduce airborne exposure to the virus. What does this mean? Does it mean that all facilities need to update their air filtration and ventilation?
Well, of course, the answer to this is complex as well, because it depends on what the district currently has. One of the things that we've done, and you can look at many different types of things that have to do with the HVAC, filters, the humidity setting in the room, UV lighting and the issues that come with it, the compartmentalization of rooms, not having shared ducts, mixing the airs, displacing the air that's in the room. All of those have to do with the types of systems and how the system is run and what their existing systems are. We look at it and have shared with our districts, and we call it a now, near, far type of scenario. So now would be what they can do to their systems to open school in August. Near would be the other simpler things that they can do maybe in the next 6 months to adjust or update the system. And then the far would be long-ranging replacement, taking out, changing up the entire system overall. But in looking at the study, we, as part of our best practices report, we had Branch Patterson, who is an indoor air quality engineer that we work with, do a study for us. And one of the very simplest things that they showed us out of their report is that in a typical classroom, you have 25 students, airflow CFM is 25 or 15 CFM per person using a MERV Air 7 air filter. So that's a typical filter, a minimum efficiency reporting values is what MERV means, and MERV 7 filter. If you adjust your system, which is just adjusting the settings you have in that same classroom, and change out to a MERV 13 filter. So this is just basically changing the filters that you have in your system. You can reduce it by a factor of 2. So basically taking a MERV 7 to a MERV 13 filter, using all the same systems that you have, decreases that risk of spread in half. So that is a very simple thing that you can do. The more complex things that you can do are controlling the humidity and then changing your return air system to compartmentalize, lots of different things to do in the system. So now near far, now would be for districts just to change their filters out and decrease the system flow by 1/2.
Wow, that is super informative. Thank you so much for that. Needless to say, I have no clue about air filtration. So when I first read about it, I thought, oh my gosh, how are they going to do this? So thank you for that. Sylvia, you have spoken a lot about the socio-emotional aspect of learning. And I know when you and I first met at Ed Spaces, that was the one topic that we just jumped on. So how will this change affect kids in both in their emotions and their ability to socialize? I know, Robin, you had also talked about this. Feel free to pitch in as well. We do design and manufacture furniture that does try and integrate kids and collaboration and, you know, working together. We know that middle school adolescence is a very testy age for kids, so we're trying to push that socializing factor even further. So how do you think this is going to be affecting kids, and what do you think could keep some sense of normalcy, so you know their mental health doesn't go to the negative side, and they feel that social aspect is stronger than ever during the crisis?
Yeah, well, one thing that I keep saying is that this is the time to be creative, and this is the time to imagine. This is new times, you know, things have changed. So one thing that we need to take in mind, that all the students and the teachers, they need a place to survive, but they also need a place to thrive. So it's really understanding, as Robbie mentioned, that the classroom is about curiosity, it's about imagination, it's about creativity. So how do we put all this together with the safety measures that we need to implement, right? So the task is we need to design with adaptability and resiliency in mind, because we don't know if this is going to happen again. We need to be flexible. We need to design with maintenance and cleanability and well-being at the first front, and really design for remote learning and just in order to give options to different pedagogies. So the interesting part is we need to create environments that are very engaging, and they're curiosity and imaginative, but they're also safe. And the problem is that a lot of the students and a lot of the teachers are coming with a lot of fear, with a lot of stress, with a lot of confusion. So how do you design for that? And especially if you're talking about confusion, is to be, as Lindsey was talking about, is to use communication to the best possible way. Is to be clear about signage. So people know where to go, when to go there, what to use, basically so the expectations are clear. Robin and I were just in a seminar, and one of the school districts, I believe in Kentucky, they're doing videos of how the school is going to look like when people come in. So it's not a surprise. So that will take some of the edge away, you know, some of that stress of not knowing what's happening. Also is making the students be part of the solution. So teach the students what's COVID and how that gets spread and how to protect themselves, because when you have control, you feel better, you feel more at ease. Integrating the students into the cleaning procedures. You know, it's not just the janitorial, it's not just somebody else cleaning, is you need to protect yourself and you need to clean after you. So you need to clean your utensils, equipment, anything. And funny enough is to make cleaning protocols visual. We feel at ease when we see people cleaning. Like, I don't know if you have seen in restaurants when now that things are opening up, they clean your table before you sit in. They do that mentally, so you're at ease, so you know that they're cleaning. So putting the sign outside the door saying, you know, this was clean at this time, and it just puts people at ease. You know, it just brings down the notch. And we really can think, we really can learn if our cognitive, our emotional side is not taken care of. So right now we're reacting to an emergency in a physical way. You know, we're doing the social distancing and we're putting sanitizing stations and we're doing, you know, separations. But we really need to take care of the emotional and the cognitive side of the students and the teachers in order for learning to happen.
Those are great pointers.
Yeah, I have another thing to say. Somebody was talking, it's like, how do you create this welcoming environment, right, with all these divisions? And I just want to quote Cheers. I think we all remember.
Yeah.
You feel welcome. Yeah, I mean, you really feel welcome when people know your name, right? So it's not just about teaching anymore. It's about that personal connection that needs to happen between all of us.
Yeah, I'll just interject that Sylvia and the company Leggett is now opening our studios for the first time since the COVID. And I told someone, you know, COVID has lasted right now for about 3 months, which is usually a summer break. So we were laughing yesterday that it was kind of like back to school because there were only 7 of us in the office, but we all put on our new school clothes and, you know, that smell of new markers and all of that excitement about going back to school really came out. And although we've been functioning really well with the e-learning and the e-communication, it was so nice to be in the presence of my coworkers. It felt like home, you know? And so I think that feeling for students and teachers will be something really important for them to have. And furniture and the environment is important, but it's really that personal connection that is missing with the e-learning. So I think that welcoming piece that Sylvia hit on is really important.
Oh, absolutely. And besides, there was something on the Wall Street Journal that we can discuss towards the end, saying that academic learning dropped by 40% when it went remote. And I know probably a lot of it is linked to the fact that no one was prepared to this, but the human connection factor is indeed crucial for kids to learn. So thank you guys. That was great pointers. Loved it. The next question is for Dr. Leininger. There was a study that was conducted by the Netherlands National Institute of Health, and it found that children under the age of 12 play little role in transmitting COVID-19. So what do we know today about the different ages and their susceptibility on catching or spreading the virus to other children, but mostly to adults? Particularly thinking about our teachers.
Thanks. Well, there are 3 key things to unpack with this question and with that study and the body of evidence that speaks to this. So how likely children are to catch COVID once exposed, how likely they are to have a bad course of disease, and how likely are they to spread COVID. So that's the 3 things that scientists are working very hard on right now. And I got on the phone with 2 other nerdy girls last night so we could crowdsource the answer to this question because, you know, scientists, we're not a monolith, right? We all have our opinion. And so I'll tell you what the crowdsourced nerdy girl take is. So we feel good and confident about the science around children not having much lower risk of serious disease. I think that just, you know, that passes what we call the interocular test, the eyeball test of the numbers. We feel pretty good about the science and the emerging data that children are less likely to catch COVID. So really only, you know, there was some early evidence in Wuhan that didn't suggest, you know, that suggested they might be as likely as adults, but every study since has shown that children are actually less likely to become infected if they're exposed. And then where I think the scientific tension remains and where it gets a little sticky among our own group and scientists in general is about this issue of if kids can transmit as efficiently as adults. Now, the Netherlands group is out there taking the stance, no, they're not as likely to transmit. Me and my fellow nerdy girls aren't quite there yet. We actually wrote a post about this on Dear Pandemic yesterday, so it's top of mind. We think there are some suggestive, hopeful signals that transmission between young children and adults is less likely than between older children and adults. but we're not willing to go as far as the Netherlands group right now. So again, like the nerdy girl take on the research is definitely less likely to have a bad course of disease, very likely less, very much less likely to catch the disease. Jury is still out on transmitting the disease, but looking hopeful.
Thank you so much for that. Robin, I'm going to jump back to you. Speaking of design solutions, the importance of being around each other in schools, what design solutions do you recommend for the early learners? I mean, many districts have now integrated preschool as part of their elementary school. What would be the best practices for the younger kid? And how are they going to keep this going? Because the idea of having, even whether it's all 25 or just 8 or 10 of them under some of these guidelines seems like a pretty rough job for those teachers. So what are your ideas on this?
Well, I think we can go back to the recommendations of the cohort and keeping families and neighborhoods together. So like even riding the bus together, these kids have been playing together during the quarantine, so they've already kind of connected in terms of their neighborhoods. Is keeping those groups together and making sure that we're tracking if one of those groups is. It's so reassuring to hear that the younger kids are not spreading or not catching it as much. So there's some confidence in the science. And then one of the things that we're looking at, and we're actually going to be speaking about, Sylvia and I, on Fridays, is outdoor learning. And we know that the air exchanges, that it's very low risk outside to spread the disease. So is there an opportunity for courtyard spaces and outdoor play to become integrated more in design of early learning spaces? One of the examples in Mount Prospect of a facility that's been open now for 5 years has 4 different outdoor environments, and they're all enclosed courtyards, so the little ones don't run out of the space, but there's a large motor area. There's 3 sensory gardens where there's interactive and tactile learning, and they're just about the scale of a backyard. And the students feel so comfortable out there. And we actually worked with the teachers and the administrators to design the outdoor spaces first, and then designing the indoor spaces around them. And we did a survey over the last 3 to 5 years of use, and the students are out there every day, multiple times. And they say there's no bad clothing, there's no bad weather, there's only bad clothing. So, right? So they put their jackets on, they've got their boots on, they're out there in the puddles. And this generation is the generation that doesn't get outside as much as we did in our past. So getting the kids outside, making opportunities for learning, even in the snow, and being a little bit fearless about weather, especially here in Chicagoland. So I think it's opportunities to open the window and explore outside is one of the recommendations. And then one last thing is the circulation patterns between classrooms are opportunities for learning, and designing areas that for exploration. And we're actually added stairs and a stage kind of environment in the hallway because the OTPT crowd needed those kind of opportunities. But there are story time areas, there are other areas that the students and their cohort can use and have an opportunity in terms of design that it's outside the classroom. So I'll stop here.
That's awesome. Well, maybe for a few in Texas, depending on the heat, we might be able to apply that. Surely during fall, winter, which is really a spring, summer here in Texas, but thank you for that. Dr. Leonard, here's, I think, the roughest of all. It was reported last week that the Texas schools will not directly receive funds from the CARES Act. but instead it will be allocated to the discretion of the TEA. So I know we're bringing in all kinds of solutions and possibilities, but how much does a school district need to prepare to safely reopen? And you yourself mentioned that every district has a different scenario. So based on your experience, what would you recommend your peers in different districts?
It's a complex question. You know, I think prior to the call, we were discussing that the federal government has done a nice job by bailing out the cruise ships and the hotels and the airlines, but not yet school districts. And money they've given to the state in Texas, the state decides how to distribute that. And as of now, when they give us $100,000 due to COVID, they take $100,000 out of our budget somewhere else. So they're really just supplanting the money, and we've not received the money yet. And it's difficult when you start thinking about how much this is going to cost us. It's like going on a trip, and you don't know if you're going 50 miles or you're going 5,000 miles. You know, there are some scenarios where I'm remote that I actually can save some money, because I don't need the bus drivers, I don't need food service, I don't need some of those services. But then if I am in person or partially in person, the cost for cleaning supplies, the cost for additional staff, overtime for maintenance personnel, additional bus routes because I can't get as many kids in a particular bus, is staggering to kind of start thinking about how all that could play out. So most superintendents I know, they're throwing a dart and they figure they're going to have to adjust as they go. If I could flip back though, I am really sincerely, and I mean this sincerely, glad that we got the nerdy girls out there.
Thank you.
I think it'd be a great name for a rock group, but that's for another time. The interesting piece though, you know, even when the science is in one place, people's mental models can be in another. And elementary schools, elementary teachers in particular, rightfully to some degree, they're not being mean. They're just saying, you know, these little kids are germ bubbles. Flu goes through them and everything else goes through them, and it goes to me. And that's what they're used to. And little kids are sometimes hard to get them to sneeze in the envelope and, you know, keep the mask in particular position. You know, what Robin and Steve were saying, and what we're thinking about, is with cohorts and having kids come in and out and stay in a classroom and have the special teachers, music and art, come to them rather than going into those other rooms and repurposing those spaces. But all of that costs money and will be extremely complex. And again, with the contact tracing, once one or two teachers start getting ill, that'll be geometric in terms of the other teachers who will be self-quarantining. So the money is a mystery. And right now, most school districts are going to be going into fund balances to try to navigate this.
I was just going to interject that today, when we were talking, the interesting thing of these large districts is that there might be a neighborhood, right, that does have a case. And if you have a neighborhood schools, you can shut down that school while other schools could still be operating. So it's really tricky, but one of the larger school districts we were talking to was hiring an epidemiologist to help them translate the data and the science and the nerdy girl information and implement that in their school district and track it and make recommendations. So I think it takes it takes the village, right? It takes all of us and all of these experts that are sitting around this table right now. And then the additional experts that are around us that are feeding the information to make these decisions. And as I said, most of the superintendents we're working with realize that they're going to have to take ownership, and that this decision is going to be local and it's going to be their responsibility. One of the superintendents gave a story about that he was at a softball game, and everybody was social distancing, everybody was following the rules, but one of the sluggers hit a home run, and then all of the students came out of the stands and they were high-fiving and all of that happening, and he was like, what do I arrest these kids? I mean, what do I do? How do I stop this from happening? Because it's human nature, right? We can't monitor human nature. So I think it's a tough role for a superintendent. We talk about teachers and educators being the most resilient group, and I don't envy the situation that you guys are in right now, because it is really tough decision making and how you protect the students that you love and the teachers that you love. How do you protect them?
And
So
Robin,
it's a tough place to be.
Robin, if I could play off that a bit, we've talked about neighborhood cohorts as well, and most of our schools are neighborhood schools. But where it gets really complex is we have permutations within these families where they have an elementary, middle, high school student, and that's across. And then we have some students who are taking special programs in special buildings. And we are going to be navigating this like a pilot flying through a storm, I believe, throughout the whole year. And the complexity of how kids are interacting, and that's when we're controlling their interactions. And there's a whole litany of interactions that they're involved in that we have no control over. So it'll be fascinating to travel this journey this year.
I'll just interject again. Ohio is one of the high school groups has divided their entire family groupings into 3 different groups. So there's an A, B, C group, because that's how they figured their facilities could handle a population. And exactly what Tom said, if they have a kindergartner, a 10-year-old, and a high schooler, they're all in the same A group, and their parents are in the A group too, so they can go back to work. So what they're doing is a week rotation. So you're on for a week, you gather, you're having that connection and the collaboration in the classroom, and the teachers are connecting with the students and delivering one-to-one education. And then they're sent away for 2 weeks to do e-learning. And the same is true with the parents. If they've got jobs, they're on for a week, but then they're home for 2 weeks. And so they've divided their whole county into this condition. And that's allowing them to have a little safer feeling about, their whole family is part of the same cohort. So I don't know if that helps you, but that was one thought that I had when you were speaking.
Great feedback, guys. Moving on, Sylvia, the American Academy of Pediatrics has echoed that we do need physical distance in classrooms, and we're back to this. Can we make a classroom smaller? Many schools won't be able to. So what support do designers need to implement changes based on the needs of the school and the resources that they can only have or afford?
Yeah, well, interesting enough, this is when we all need to work together. So it's not just going to be the designer trying to figure it out, how the classroom is going to end up and what the circulation pattern is, giving recommendations, but actually working with the administrators, working with faculty, working with, as I've heard before, with epidemiologists, with doctors. It's basically having this resource of knowledge so we can apply to the learning environment. Things that can be done without big expansion, or like the mechanical systems and that kind of stuff, is obviously the space, the social distancing plans have that at hand. Having that traffic flow direction, not just for the classrooms, but for the whole campus or for the building itself. It's like how students will move from one place to another, and teachers as well. It's having flexibility of function of the space. What that means is, using the cafeterias or using the gyms as secondary classrooms to bring some of the count in, because you basically are going to be taking furniture out of the classrooms, and that will be a place to add classrooms. So it's just going to be like a puzzle kind of thing. We need to do spacing identification through color, through pattern. That can be just painting on the wall or stickers on the floor. And it can be identification, but it can also be fun. It doesn't need to be just a line. It can be something that people can learn, something that students can be engaged to, something that students can actually do themselves, like the signage. They can draw their own signage of cleaning their hands, and just because they did it, they're going to do it. So, you know, it's engaging everybody. It's not just, if there's anything beautiful about all this that is happening, is that collaboration between all the trades. I mean, the way we are communicating is insanely, and it's a good thing. So we need to learn of what we know, apply what we learn, and go to the future in a positive way. Another thing that is very important is furniture. And the fun part about this is because we are telling the students and the teachers that you live in this bubble, right? So you need to stay still within your bubble, and that is 100% impossible. So how the furniture will help you move within your bubble, you know, like racing up and down stations where you can stay put, but you can at least you can, you know, stand up and sit down, or how the furniture can actually be ergonomically enough so you can actually fidget within your bubble. So you're still in your bubble, but you're still moving. That will be part of your physical health. That will be part of your mental health, and that will help you learn, you know, in your cognitive side. So just to share, miracles can do, right? Yeah, I know. You know, putting sanitizing stations in specific locations, that will be part of something that needs to be done, and it's, you know, it will be an expense. And like we were talking about, those non-permanent dividers, cleanable dividers that can be plexiglass, or can be, you know, a bookcase, or can be cubicles. And the fun part about this is that right now we're separating students, you know, 6 feet. In the near future, we're talking about the cohorts. The same way we were separated from society, little by little, we're getting together, and that's going to happen. I can see that happen on educational. So there are going to be these smaller groups that starts with 2, then are 4, then are 6, and having those dividers in order to really control the environment, it's going to be key. It's nothing that is just going to stay in 6 foot. Hopefully soon it's going to open a little bit more. Acoustical treatments. Again, if people are wearing masks, if there's going to be dividers, you need to think about acoustics and how that's going to affect the learning space. And taking away clutter, removing anything that is not being used in the classroom, so you can have more space for actual students and less things to clean, less things to have germs. And as Robbie mentioned, get outside, open the door, have natural light. Let's go back to the elements, because that's the safety way. That's the safety way to go. So, kind of in a nutshell, you know, from an interior designer, this is not just about the physical classroom or the physical space. It's about the educational ecosystem that is happening. And I think it's going to be a new way of learning, a new way of teaching. New pedagogies are coming up, and it's going to be a positive change. It's just change is difficult sometimes. Change hurts, but I think we're going to go in a good direction.
Awesome. Thank you so much for that. And then closing our series of questions before we open it up to the floor. Greg, we are 8 weeks away from the official start of school in most states. So we have some answers. I think everybody's coming together as a community to come up with better solutions. But it's the time factor. Can you talk a little bit about the quick ship process and lead times for not only classroom furniture, but really for the solutions that are needed to reopen a facility?
Yeah, sure. And just as every school is not, you know, experiencing the same thing, every manufacturer is not either, and the marketplace should be aware of that. But, you know, as manufacturers, we know as much as the rest of the panelists do. We know what we're being told, and we know it's going to change, and it's probably going to change frequently. So 25%, 50% of the population, what is it going to be? Hybrid, completely remote? We don't know. What I can tell you is that, this business of servicing schools for their needs is not always the easiest one. And in a year like this, it's perfectly explainable that in time of scarcity and knowing what to do, decisions are going to be put off and things are going to happen late. And fortunately, we've got a very strong stock program we can help people out with and deliver full classrooms within 5 days. So, we've got some things there. What I would tell the audience and ask you to pass along is, while I've heard you talk about dividers, there is a scarcity on acrylic, and all of a sudden the whole world wants acrylic pieces to protect their environments with, just like they wanted masks. And as you know, masks are easier to get now 3 months later, but I'm looking at a timeline of 8 weeks. And so I also understand that schools have budgetary concerns, and we're not even in the next year's budget yet. But what you can do is start checking, start asking, and start communicating on this subject as well. What I would hate to see is anxiety over having acrylic dividers, which honestly are a lot easier for some teachers because they can see through them than say a porcelain divider. I would just encourage everyone to start talking about it, communicating on it. And I can tell you, companies such as us, we've stuck our neck out there. We're extending ourselves without knowing what demand's going to be. But when I look at the demand of every school district across the country, I know there's no way I could service all of their personal protection demands and needs within 8 weeks. So that's what I would encourage, Polly, and want people to walk away with. No matter where they get it, please start thinking about it and communicating on it.
That was very good. Well, that concludes the round of questions that we had prepared. This is time for open floor for our panelists. If you have any questions for one another on one of the topics we discussed, and as well to our attendees who are pouring in with some questions as we speak. Let's see. We have one from Catherine. It says, since this is such an unprecedented event, my apologies, it's hard to provide districts with the proof that the investments in new tech, furniture, and other measures will be worth it, since there are no case studies to show the effectiveness. What can we do to make sure these ideas are being heard and implemented despite the lack of funding many schools seem to be experiencing? Anybody want to address that? It's a lot. So I guess designers, one is to be able to provide the tools, but really, if there's no funding, what do we do then? Sylvia, you're muted. There you go. Yes.
Sorry. I think you, in a good way, but you work with what you have. So you do an inventory of the things that you can do, and basically you work with what you have. That will be the advice that I will give. You look at, you talk to everybody, have the conversation, reach out to your neighbors, meaning, another school districts, get all the information that you can and do an inventory of what you have and what you can do.
And may I add one point of scientific context?
Absolutely.
So low resource settings, the small and stable cohort model becomes much more attractive. Because I think one thing that I have not appropriately flagged on this call and want to do so now, that by moving to the small stable cohort model, you actually don't have to worry that much about other infection control measures. I mean, it's still good to have them, but it's not like all infection control measures are the same. Like, the small stable cohorting is something that I know people in low resource settings are adopting. And, you know, one of our nerdy girls, Jen Dowd, she's a demographer and epidemiologist at Oxford. She wrote the seminal piece of science on this paper published in Nature that demonstrates that this cohorting is really, can kind of supersede the other stuff if you're in a low resource setting.
Thank you for that. On the notes of the CDC, it was recommended to shut down communal areas. However, a lot of these options are no, make the communal areas impromptu classrooms, maximize the space of those areas that are typically not used. So if we do we disregard the CDC recommendation? Can we? When it becomes to that school, Dr. Leininger, can you just do with your facility what you find best?
Yes, but I think we're operating under the same idea. There are, you know, one of the questions was about vocal music and band and art and some of those other programs that typically happen in schools that require kids moving from one place to another. There's a likelihood that some of those will be much more difficult. Oh gosh, my video is not going. I'm sorry. That so that would be much more difficult to do in this new world. But what we're planning on doing is utilizing some of those spaces in different ways. So a typical music room might be a classroom. A band room might be a classroom. A cafeteria may be 4 classrooms. And as much as we can in Texas, our weather is pretty good throughout the year. Almost all of our PE, which would be done in cohorts with separation, would be done outside because that seems to be the best place to do it. So we would do all of those things. Again, it becomes a little bit of a problem when you start utilizing all those places. If a class of 26 had 1 teacher, I immediately don't have 3 or 4 teachers, even if I can find places to separate those kids. So again, we're working on a swivel method. We plan on having some kids remote while we'll have some kids in person. The technology in our case is good. The teacher can be teaching in the classroom with 8 kids, and there can be 10 other kids taking the same lesson remote. So we also can, inside a school, particularly at the high school level, if the teacher is compromised and must be home and teaching remote, the student can find a space in the high school or with internet access, they can connect to the teacher who's in remote. So they may be in person period 1 and 2, remote period 3. There's going to be a lot of, again, permutations in terms of kids' schedules and what's going on throughout the building.
I'll just answer it. We can't ignore the CDC guidelines because that is the recommendations that our nation is using. But I think we can use the same principles that have been recommended for the classroom for those shared places and still be successful in learning in the shared areas.
So basically just having different functions for different classrooms. That's the flexibility of the space. You know, as CDC is recommending, it's not recommending the cafeteria to be open, so it's more of a box lunch. That's what they're recommending. So again, you have an open space where you can spread out students, and you can use the space.
I think if I could, and it was in one of the questions I think that was out there about kids with special needs, and we haven't really talked about that situation directly. But, you know, as we shut down and we surveyed parents, and this is just not us, this is everywhere, the kids who are at risk, the kids who are have significant special needs, had a much more difficult time navigating remote learning than other kids. And younger kids had much more difficult time than older kids. And there are some things that are just not easy to do with occupational therapists and with students who are deaf, students who have significant behavioral disorders where they are not going to social distance. They just are not going to social distance. And they are not going to wear masks. And we're going to be in a situation where we're going to try to have to navigate those situations. And that will be very difficult.
Lots to think about, and only 8 weeks to try and find those answers. I think we have time for one more question. And let's see. It says, is the setup of barriers good for air-conditioned rooms? And I believe, Steve, you might be the one answering that since you spoke about the
Yeah, there's a couple of different issues related, questions related to the AC systems. So the AC systems, like I said before, are all going to deal with what you have in your existing district right now and moving the air in the room at different levels, whether there's a plastic shield or some kind of divider between the students or not, the air's still going to move in the room up high and down low. You can circulate the air in the room. The other piece, or some other questions I saw in there related to the HVAC are more information about filtering and UV light. So in filtering, you know, I mentioned a MERV filter. There's also HEPA filters that I think everybody's heard of. There's also the plasma filters, the bipolar ionization. All of those can improve the situation you have. What you would need to do, or districts need to do, is understand what they have now by getting an indoor air quality consultant like Branch Patterson or anyone in the nation to come and understand the system they have and what level, the now near far I talked about, what level of system. Just changing a filter, just changing the way the systems run, changing the ductwork. But the interesting thing that's coming out that we see about the UVC spectrum lighting, which can be added to HVAC systems, has a great benefit in penetrating the cell structure of the RNA of the vapor in the water and destroying the germs or part of the germs as you go through by using light. The one thing that's not the best about the UVC spectrum of lighting is the fact that you don't want to expose people to that light because it's not good to have that all the time. It's like sunlight, you know, this is a level above sunlight, but you can put it in the system. You can put it in the ductwork where it's not exposed. That system is one of those FAR systems that I talked about, that's going to take more work, more money, but all the research that's showing right now is that is a really good extra add-on to the system that can come later, as well as I talked about the compartmentalization of HVAC systems, a FAR solution about instead of having classrooms return air ducted all together to go back to and circulate there, that those all get separated. So there's lots of different levels to start with. Like I said, as easy as changing filters all the way to changing systems and everything in between.
I just want to interject that one of the stories that I've been reading about Europe reopening was that they were opening all the windows. And I know that short circuits the mechanical system, but it also provides those air exchanges that help with the less spread of disease.
Absolutely. That is one of the very easy solutions, is just open your windows if you have operable windows in your classrooms. And that works great. Yes.
Thank you so much, guys. We're a little bit past our hour, but that's good news. Everybody was engaged. To our attendees, the questions that we have received and were unable to answer, we will forward them to our panelists and make sure that if they can't take the time, answer back to you. This is a recorded session, so we can send you the session as well. And again, to all of you, I know to me the most important thing is this: bringing all minds together, working together to find a solution. It's a tsunami, so we may not have the perfect answer, but it will be better than not having done this before. So I really appreciate your feedback. If you guys want to give your last words for closing, it's open to all of you.
Thank you.
Thank you for the opportunity to share.
Thank you.
Thank you.
Yeah.
Yeah, thank you. Let's keep the conversation going. This
Absolutely.
is an ongoing.
Stay safe, be well.
Yes.
Stay sane.
Yes,
wear
and I've got,
wear
Dr.
masks.
Leonard, I've got one more idea. I'm going to be calling my representatives about bailing out schools because, you know, I mean, we got to do something, right? So cruise lines and not schools just doesn't work for me. So I would ask everyone that's watching, please do the same. Schools need help. We're all in this together.
Great.
Sir.
Thank you so much, everybody. Have a great rest of the week.
Thank you.
Thank you.
Thank you.
Bye.